But the SOHO-01, this is a trial for patients with HER2 mutations. It's very important to remember that these patients, they have an unmet need because we have only for these patients in first-line chemotherapy, and chemotherapy is not a very good option for them. And we have trastuzumab deruxtecan. That's a very interesting second line. A major problem is you have to go through first line to get to second line, and then we don't know what to do after trastuzumab deruxtecan. So what we have, the drug is called right now, thanks God they got a name for it because it's the letters and numbers were so difficult to say, but it's called sivobertinib. It's also an oral drug, a TKI, that provided a 59–60% response rate. There were two cohorts, different cohorts. First cohort was for patients that were pre-treated but naive to HER2 targeted therapies, and the first one, the other one just for first line. It's a trial that has a very limited follow-up. For the first cohort, the pre-treated patients, is about 8 months with a median duration of response of 6 months, but maybe just because we're talking about a drug, a trial actually, that had a lot of patients being included recently. When we look back at this year's ELCC, last year's WCLC, we got even better responses, like 70%, 71%, because maybe there were less patients on the trial, and now we are waiting for longer follow-up. And it's interesting because the drug can be used after trastuzumab deruxtecan, and it becomes another option. I don't think TDXD is so bad to use compared to amivantamab. It's not as tough to use. Bad isn't a very good word. It's not so tough to use. But once again, it's an intravenous drug, so you have to go to the clinics, you have to cope with maybe pneumonitis, you have to cope with nausea, fatigue, and once again, it's a drug that causes rash, diarrhea. It's a very straightforward profile of TKIs. And well, I think it's another option. And once again, we have trials in first line being run right now. We have the trial with zongertinib, which is a drug from Boehringer, the trials which is called the BEAM-Young-Lung-02. We have the SOHO-02 in first line as well with sivobertinib, and we also have the DESTINY-Lung-04, which is trastuzumab deruxtecan in first line. And once again, we are anxiously awaiting that because maybe getting a TKI to patients previously, getting a good response, getting a good duration of response can make patients' lives a little better.